I'm here to present a study that was done by the ARISE team across all sites. So the title of my presentation is Prevalence and Factors Associated with Anemia Among Adolescents in Sub-Saharan Africa and India. Results from the ARISE Cross-sectional study. Anemia is a global public health problem, and we have regional, sub-regional prevalence rates. The cross-continental prevalence rate is lacking, and therefore this study sought to look at the cross-continental behavior of anemia among adolescents 10 to 19 years. So the design was a cross-sectional study, and the countries or the sites that were involved are Burkina, Ethiopia, Ghana, Nigeria, Tanzania, Uganda, and India. China, as Manu presented, he mentioned China. We couldn't use China data because they didn't allow them to draw sample, blood sample, and therefore they were dropped from the analysis because our sample depended on blood sample. So we used the outcome for this study was anemia, and therefore we use blood sample, finger prick blood sample, which we use the HemoQ to analyze it, and we applied the WHO recommended thresholds to do the assessment. They have different cutoffs for different age groups, so we applied that, and then we came out with a unified outcome variable called anemia status. So other variables of interest were also defined. For example, body mass index. For the sake of time, I can't go into the details of that. And then you also use the global diet quality score to do the as an independent variable. So our analysis we use frequencies, and then to describe to summarize the data, and then bivariate we use chi-square and simple logistic. Then the multivariable analysis we use logistic regression. And our modeling effort, we try to do a stepwise logistic analysis where key variables were first put into the model, and then we did it in 3 stages. So at first we put in the basic demographics, and we noted the significant variables, and then later we applied the global quality diet score, and it was significant. But when we added other variables, it was not significant. Therefore, we came back and then used the individual food groups in the global diet quality score, and then to analyze, and then we were able to determine some associations. So we found that our results, we found that about 52% of the adolescents were female, and then 57% had at least attained 7 years of education. The mean age for the adolescent was 14.2 years, and then majority, which is 53%, were young, early adolescents, 10 to 14 years. So our sample was largely early adolescents. So we tried to estimate the pool prevalence of anemia, and we found that the pool prevalence was 41.8%, with a confidence interval of 40.8 to 42.8. And then part of the analysis, we tried to look at the severity of anemia, mild, moderate, and severe. So we noted that approximately 4% had severe anemia, 50% were mild, and 46% was moderate. So the chart that you see is not too clear. Is the prevalence across the various sites. So we had Ethiopia having the lowest with 5%, about 5% prevalence of anemia, and then Ghana had about 73.6, about 74% anemia. That gave the prevalence of 41.8%. So in our logistic regression, we noted that BMI was significant, and that those who were normal and overweight were less likely to be anemic compared to those who were underweight. And then consumption of fish and other consumption of fish, this one was interesting, was we found that people who consume fish were more likely to be anemic. And also consumption of eggs, people who ate eggs were less likely to be anemic. And again, we analyzed with the country, the size, and we noted that staying in Ghana has a higher risk of being anemic and compared to those who were in Ethiopia. So what is our conclusion? So this study has revealed that a significant public health challenge exists, and that high burden of anemia among adolescents in the Sub-Saharan African region is a problem, especially among females. Secondly, the link between reduced anemia risk and consumption of egg and legumes heighten the importance of nutrition during adolescence. Then the last point is that there is a need for tailor-made intervention on nutrition so that we can reduce the burden of anemia. At this point, I want to acknowledge the Harvard School of Public Health who coordinated all these studies. I want to acknowledge all the ARISE sites and also the study participants, and as well as the funders, Foundation Botna. Thank you very much.